Hi, my name is Jennifer Clawson. I'm an Associate Director at the Boston Consulting Group, and my role is to lead the value-based healthcare internationally for our firm. Value-based healthcare is a fairly simple concept, and I think one that almost everyone who's exposed to it agrees with. It's basically about improving the patient outcomes while at the same time maintaining or even lowering the overall cost to deliver those outcomes. Now, this concept was originally published in a book written by Professor Michael Porter and Elizabeth Teisberg in 2006. It's been a concept that's been a journey of implementation, but it's now proven. Wherever we've seen it implemented, we see that the outcomes improve overall, and the costs are either the same or the overall costs do go down. So, for example, what this actually means is that historically, many healthcare systems are under strict financial pressures. The healthcare costs in many countries are rising faster than GDP. The focus on outcomes, which is a fairly new focus, actually allows organizations, healthcare systems, governments, regions, to figure out what actually drives the improvement, what contributes positively to patients getting better, what maintains their health, and at the same time, what are those things that may not be contributing to a better outcome? And for those things that aren't contributing, we can remove some of those from the way that we provide the care. And by removing the things that don't provide improvement to the outcome itself, we can lower the costs by taking out either direct costs and or indirect costs by making the way we provide procedures more efficient, making our operating rooms more efficient, and the like. It's a great question. So I think value-based healthcare is strongest in some of the countries which have been looking at outcomes for the longest period of time, which is quite obvious statement. What does that mean? It means countries like Sweden, a very small country, but one which has a long history of setting up disease registries. In other words, these are registries that track patients with specific medical conditions and what are the results they're achieving. Countries like that have gone the furthest in implementing and using value-based healthcare. Other countries that are very far along the journey include the UK, the Netherlands, the United States to some degree. It's a very fragmented system, but we see some areas where there's great promise and great execution. But there's also room for in any nation and within any individual organization. So, for example, in any particular provider organization which has more than one site, they can start to measure the outcomes at hospital A versus hospital B versus hospital C, and by comparing those, figuring out where are the best outcomes achieved, why is that, and then they can raise all of the outcomes for the patients and provide even better value care. So it's applicable, I think, anywhere, but we've seen it taken the farthest some places already where there's been a history of outcomes tracking. Definitely, I think it's a great question. As I was just saying before, I think the measuring and transparency of outcomes can be done in any organization. And when we start to work with provider organizations, we see benefits within 4 to 6 months in terms of improved efficiencies and raising the overall outcomes. And then within the first year, we typically see impact on the cost as well. One of the intangible benefits, which is really great, is that once you start to get the clinical staff engaged in looking at the outcomes, it changes the perception. Instead of facing another process re-engineering program, another cost reduction program, another pathway redefinition program, this suddenly gets back to the reason why many people went into medicine and healthcare in the first place. It gives them data to operate with that can help them improve their own outcomes. It helps them learn from the best practice, identify what that best practice is, and innovate in a faster way than simple adherence to protocol per se would allow. So BCG has been focusing on investing behind value-based healthcare for over 5 years now. We work with clients, clearly, across all the sectors of healthcare, provider organizations, payer organizations, life sciences companies, as well as governments, to figure out how can they start to compete in a healthcare world that is going to be much more focused on outcome transparency. In addition to that, though, we have had support from our executive committee to do some investment behind that. And so what does that mean? That means that we have helped to create and launch a not-for-profit organization called ICHOM the International Consortium for Health Outcomes Measurement. So the BCG, together with Michael Porter's institute at the Harvard Business School and the Karolinska Institute, a leading academic medical center in Europe, we co-founded ICHOM to focus on the standardization of ICHOM, of outcome measures. And then finally, we continue to do research. Who's winning at this game? What actually makes a difference? And how can organizations really compete to win in this new environment by focusing on outcome improvement? It's a great question. So we've worked with a number of provider organizations globally on their implementation for value-based healthcare. And I think the real starting point is to get buy-in from the senior management. Once the senior management is convinced that this is the way they want to operate their hospital organization, that value-based healthcare is a key part of their strategy, I think it's fairly straightforward after that. What we typically do is identify a couple of pilot medical conditions. So for example, this could be prostate cancer, it could be hip arthroplasty, and usually, depending on the size of the organization, we would start with 3 to 5 conditions. And for each of those conditions then, we would have a medical champion, somebody who's quite passionate about the condition and is eager to get behind and help push this in the organization. Once the conditions have been identified for the pilots, then we set up a small working team, 3 to 4 people, and what we start to do is essentially work with a cross-functional group. We bring the nurses in, we bring the doctors in, some of the other therapy staff, etc., along with patients and patient representatives to figure out what are the outcomes that truly matter for this patient group. We use also, where possible, international standards. So we look at the ICHOM standards for specific sets where they've been developed so far. And we've come up with a small set of measures. We're not talking about 50 or so. We're talking about a handful that can be reasonably measured and which matter to patients. Once we have those, we start to track. Tracking can be as simple as pen and pencil. It should be something that fits into the workflow easily. And sometimes what we found works really well is identifying what's being tracked today that may not necessarily be adding value. So physicians and nurses are always time pressed. Where are the ways we can help them save time, remove some of the things that they may be doing today, and add in the outcome measures as part of the workflow? And then I think the real critical element becomes, after we've defined the measures, after we've started the measurement process, using them, because that's really where the improvement starts. And that's around identifying the functionality as well as the periodicity of getting the group together. So in most organizations, this is at least a quarterly meeting where they start to review the results. And so in one example, in the first month, they would say, these are the results for Clinic A, Clinic B, Clinic C. Let's look at them in conjunction with how they're doing versus each other, versus international benchmarks, versus national benchmarks, and then we can start to track over time how we're doing on these outcome measures, and even down to individual team levels. What may one team be doing really well, and what's the root cause of that better outcome that can then be translated, and we have a cycle of improvement and innovation.